All right. So I tested my audio and I think the fidelity is good enough and the room acoustics are good. What I'm going to do now is I'm going to give an overview of what I'm going to show off and why I'm going to show it off. So I got assigned this week to do a group project. And what we're going to do is we're going to work through OpenEMR here, and we're going to go through 9 tasks. And this is for the Clinical Information Systems course. And on each task, I'm going to record just in the raw. That way I can look back and like see how long it took for usability purposes and, where I got hung up at. And at the very end, I'll go through and edit out the parts that are just too long to watch and just, put like title card summaries or something like that. And also I'll be like alt tabbing between the PowerPoint here. So task one, we are in the blue group, Fatima, Jace, Jamie, and our patient is Edward Jones, and he's like like the brokerage guy, the stock market man. And we're gonna go here to Word. And then so first task in OpenEMR is to find the patient, and we're gonna go ahead and sign in. Go to Finder. There he is, Edward Jones. And we have found the patient. He needs a tobacco assessment. All right. Now we're going to go to task 2. Add a medical problem for the patient. Check vital signs for abnormalities, for hints. If there aren't any abnormals in his vitals, then add a diagnosis of your choice that makes sense given the patient's sex and normal vitals. Can do. All right, let's go to his issues. Yeah, that hasn't been populated at all. I'll go back. Vitals. Vitals had a breast biopsy. See, he's almost 500 pounds. The height doesn't make sense here. It says units are inches, 8.53 inches. Let's see, blood pressure wasn't taken. Okay, so got him up. Okay, there we go. New lump in the breast and underarm. Let's see what else we got? Let's go back. what I'm sitting here thinking about is I noticed, back to vitals. I'll also look at the encounters. This doesn't list a biological sex anywhere I'm seeing. So I have a 23-year-old patient, and then says prenatal initial visit. That could have just been, like dropped down incorrectly. Edit. Okay, found it. Demographics, sex, male. Go over to, I'm just going to assume that this was pre-populated. I'm going to ignore it as a given. So it's a male uh, with lumps in the breast and underarm. And then we're going to diagnose that. And so here medical problems. So give your presenter a little bit of time I want to look up some clinical guidelines here. Okay, so we've got some possibilities. Gynecomastia, lipoma, or cysts. The underarm lump is, I think, concerning me the most. And so this entry here, a lump or thickening in or near the breast or in the underarm area, and then male breast cancer signs. Let's go ahead and read this article. This is helpful. infiltrating ductal carcinoma, cancer that is spread beyond the cells lining ducts in the breast. This is the most common type of breast cancer in men. So we're just rolling dice here. This will be the most probable event. And then hopefully, it matches with the spreading into the underarm. And we'll probably do some more Googling here. Okay, so we got some lymph nodes that extend into the underarm. Okay, we got tests here. Very useful. Stage N1. Cancer is described as one of the following. Cancer is spread to the axillary armpit area lymph nodes and is larger than 0.2 millimeters, but not larger than 2 millimeters. So I'm guessing N1 MI is the stage. We need to conduct tests and measure it. And so, but for my pre-testing diagnosis, I'm going to check on that most common one, infiltrating ductal carcinoma. Can be spread through the blood and lymph systems to other parts of the body. Yeah, this is a safe bet because we're asking how did it get into his underarm, and we have lymph nodes right there. So we'll do a tentative diagnosis of infiltrating ductal carcinoma. And still on this step, medical problem. And then this big list. These are like stuff that has already been entered, probably. And then let's see if we can just go right to the codes. And then I'll go look up the ICD-10. This is a female diagnosis. Let's go back. Male diagnosis. Malignant neoplasm of unspecified site of unspecified male breast. At this point, I'm not sure that this is malignant. I don't think it'd be appropriate to code it. Let me spend some time thinking about that. Let's go up to C50. further malignant neoplasms. I just want a neoplasm of the breast. Neoplasms of unspecified behavior. Try that one more time. May have to get the code book. There we go. Unspecified behavior of breast. This is a billable and specific code. This alternative one. What is 49.2? Bone, soft tissue, skin. Okay, so this one excludes. Yeah, this is specific enough. So we'll do diagnosis as D49.3 and go back up here, pull this down away from the zoom. D49. And then for the purpose of this record, let me think if we have any specific time frame given. It looked like, the event occurred in 2016. And then for the purpose, I'm just going to D49.3, remember that in my head. I'm going to close that. This was 2016 May 4. And let's just say we, added it at the when the provider did his or her notes. So we'll do May 4, 2016. Hmm. 2016. May 4th. All right. Unconfirmed. This is the first occurrence. This is concern. And And then my phone just ring. I'm going to go grab that, and then obviously I'm going to edit this part out. All right, I'm back. I think comments in here would read something like, we need to, perform more tests and, order tests. And then I was trying to look up, see if scribes have professional letters actually last time, but for this purpose, let's just say I'm an RN. And this would be, we would refer the patient to oncology. All right. I think that's specific enough. Okay. And let's look how that looks in this dashboard. Just the ICD-10 diagnosis. Very nice. Okay, that is the end of task 2. All right. Go to the next title card. We are now on task 3. Find a common medication used to treat the diagnosis. Look up a typical dosage and route online and create a prescription order for it. Make sure the EMR auto adds it to the medication list. And in this document is also a cheat sheet. In the patient tab. Yeah, we can add a medication within his record. All right, so do a little research here. Let's see. Common medicine for, let's say it was malignant. Go back. All right. Infiltrating ductal carcinoma. And then let's see if, let's see, RX. That one. Okay. I want to take the type of breast cancer and get some common medications for it. Let's see, there's this really good app. Glance down at my phone. And the app is called Hippocrates. It's trying to sell me. Let's see. Oh, that's for premium only. I'm not gonna pay that. Let's see. Let's go Wikipedia. Yeah, let's go down to they changed the wiki so much. There we go. Okay. Not all patients are treated the same way. Systemic adjuvant medical therapy. What that means. Here's some drug names. All right. Is the tumor sensitive, or does the tumor have estrogen receptors? And so it'd be appropriate for tamoxifen. And so I'm going to go to this tab, infiltrating ductal carcinoma in males. And then let's see, PubMed maybe will help me. Tamoxifen. Quotes. Now let's go switch into Google. It's a good paper. Okay. So the tumor was receptive to signaling hormones in most cases, 98.4%. So it's an okay assumption to say that the uh, tumor could be sensitive to estrogen. Then DFS, disease-free survival among men who did not receive tamoxifen was significantly reduced compared to those who underwent tamoxifen therapy. And that's a great p-value. So tamoxifen is appropriate in a lot of instances. So that's what drug we're going to use for our example. And let's just pull it up on the RxNav here, tamoxifen. Okay. Use that and pull it up in EMR. All right, now I must find where to put a prescription. No prescription, add a prescription. And let's see how this is like. Hopefully after tons of tests, maybe it's like, a month later. And so that was in May of 2016. And then we're going to say exactly 1 month later on the 4th. And use the default. Looks like I have to populate everything because it's not going to be able to go out and query it. So yeah, say it was e-prescription. It was, a cancer specialist outside of our usual office. And yeah, just tamoxifen. And then this is like the number of like refills. So let me look up like tamoxifen therapy. Therapy for 5 years. So let's just say we're going to start this patient and we're going to give them like a month and then we'll have them come back to us and see how they're doing. So I saw it available in tablet and liquid. We'll just run with the tablet. So it's 10 milligrams. So let me fill that part in. 10 milligrams. And this is tablet by mouth. And then how many times a day? It's probably just one. Dosage is between, let's call it 30 milligrams per day taken in one or divided doses. So let's say we'll start right in the middle of that number. Again, I'm not your doctor. I'm just a student, 30 milligrams tablet by mouth, and then daily, I forget the acronym for daily. Prescription daily. And this is acronym. I think it's QID. Medical abbreviation. It goes for UD. is once a day. All right, so go back to our system. And then let's see. $30 tablets for a month. The patient's going to come back. Then I'm not sure what should go in this field. It's, unknown in tablet form by mouth once daily. See if we can figure it out. If it doesn't pop up in the little short abbreviation or in the the little card down here, then we'll not worry about it so much. But it'll be let's see. Take one tablet by mouth once per day. Monitor and call provider with any with any side effects. And then, yeah, we want this to appear on their medication list. And then, yeah, we can allow generics. 30. So, yeah, we want 30 tablets. And we're not going to do any refills because we're just going to check how the patient does for this all month. And then hit save. Missing a field. Okay, directions. Just one. And then it didn't take it. Try that again. One later. By mouth. And then once daily QD 0. By mouth. Okay, that took it. One tablet once daily. And at this point in our system, I think add would do another line of prescribing. And there it went. Okay, very nice. And then that is the end of task 3. I'm going to stop this video and then resume when I come back.